want to be packed, y'all.
Giỏi thế.
Okay, all right, we're on live stream now. Okay. Perfect. Okay, we're gonna start. Is everyone ready?
Born ready.
All right. Okay, we're good? Hi, everyone. Thank you for joining. We really appreciate you all taking time out of your day to join our community press conference. We're here today as an Orange County community to talk about some of the impact that the global crisis has had on us and our community today. We want to apologize in advance, so certain portions of our press conference is not going to be translated into Vietnamese or Spanish. A majority of our press conference will be in English, but some of our speakers will be sharing information in Vietnamese and in Spanish. So we really appreciate everyone for taking time to come. We just want to let everyone know we are aware of the recent executive order by the OC Board of Supervisors. There are only 10 people in this room right now. Every single person has taken the safety precaution of physical distancing. Today's press conference is going to be a bit short because we want to limit everyone's exposure and we'll be heading home afterward. But without further ado, today's press conference is community members decided to come together from Vietnamese, Latinx, immigrant communities to take a stand against the increase of racism against Asian communities and the xenophobia against immigrant communities that has risen because of this virus. We're also here to share and remind each other of our resiliency and what happens when we take care of one another. Finally, we want to share with you some of the local updates that we have been hearing from some of the city councils. And finally, we want to share with you some ways you can take action to support one another and also call on your local government to take action. So our first speaker here today is going to be Allison Vo. She is the Youth Organizing Coordinator at VitRise, and she'll be sharing a reiteration of why we're here today in both Vietnamese and in English. So Allison, can you join?
Hi everyone, xin chào quý vị. Allison sẽ bắt đầu nói tiếng Việt trước. Allison muốn nói xin lỗi trước nha, tại Allison tiếng Việt thì không có rành mấy nhưng mà mình cũng cố gắng. Allison là làm việc tại VitRise. Cảm ơn quý vị đã tham gia với chúng tôi ngày hôm nay. Allison muốn bắt đầu cách thể hiện sự biết ơn với tất cả những người tiên phong trong giai đoạn đầu của cuộc khủng hoảng toàn cầu này. Những người mà tiếp tục làm việc không mệt mỏi để đảm bảo đáp ứng nhu cầu thiết yếu của chúng ta, từ những người quản lý, nhân viên cửa hàng tạp hóa, nhân viên nhà hàng, người trả lời đầu tiên đến những chuyên gia chăm sóc sức khỏe, v.v. Cảm ơn những việc mà họ đã làm và tiếp tục làm cho chúng ta an toàn. Trong những giai đoạn khó khăn này, Allison nhớ những câu chuyện mà cha mẹ của mình đã chia sẻ về việc sống của họ trong trại tị nạn. Thức ăn được phân phối, nguồn tài nguyên cơ bản rất là hiếm. Mặc dù vậy, những người tị nạn đã xây dựng cộng đồng với lòng bao dung, sự quan tâm và quyết tâm song sốt cùng nhau. Khi Allison là một đứa trẻ sơ sinh trong trại tị nạn, Allison được nuôi dưỡng bằng khẩu phần và những người tài nguyên. Do đó, trong thời gian này, chúng ta phải làm những gì chúng ta luôn biết. Hãy nhớ những gì trong quá khứ về khả năng phước hội của chúng ta, chăm sóc lẫn nhau và hỗ trợ những người bị ảnh hưởng nhiều nhất. Điều đó có nghĩa là những người già, quý vị công nhân không thể làm việc tại nhà, quý hàng xóm, láng giềng không có giấy tờ, cộng đồng của chúng ta và các thành viên không có nơi ăn trụ. Chúng ta nên chia sẻ những nguồn tài nguyên của mình và chỉ mua những gì chúng ta cần và tiết kiệm phần còn lại cho những người khác. Tại quận Cam của chúng ta với tư cách là đại diện cho những người nhập cư Việt Nam và cộng đồng người Tây Ban Nha gốc Latin, chúng tôi chống lại sự phân biệt chủng tộc chống Á Châu và những lời vương biển và bạo lực chống người nhập cư đã tăng lên trong thời gian này. Chúng tôi kêu gọi sự đoàn kết, hợp tác, đoàn kết và hành động từ các quý vị làm trong cơ quan chính phủ của chúng tôi tại địa phương, cộng đồng của chúng ta cùng nhau để hành động, và chúng tôi khuyến khích quý vị tham gia cùng chúng tôi. Chúng tôi sẽ cùng nhau hành động và cùng nhau chúng ta sẽ bảo vệ, hỗ trợ lẫn nhau. Hello everyone, my name is Allison. I work at BitRise. Thank you so much again for joining us. I want to begin by acknowledging all the people on the front lines of this global crisis who continue to work tirelessly to ensure our essential needs are met. Custodians, grocery store employees, restaurant workers, first responders, healthcare professionals, and farm workers. Thank you for your work and continuing to keep us safe. In this moment, I remember the stories my Vietnamese parents used to tell me about living in the refugee camp. Food was rationed, basic resources were scarce. Despite this, refugees built community with compassion, care, and a determination to survive together. As a newborn in the camp, I was raised on rations and shared resources. During this time, we must do what we have always known. Remember our resiliency, take care of each other, and support those who are most impacted. That means our elderly, workers who cannot work from home, our undocumented neighbors, our community members without shelter. We should share our resources and only buy what we need and save the rest for others. Here in Orange County, as Vietnamese and Latinx immigrants, we stand against the anti-Asian racism and anti-immigrant rhetoric and violence that has risen during this time. We call for unity, collaboration, solidarity, and action from our governments. Locally, our community is here to take action, and we encourage you to join us. We have agency to take action together, and together we can protect and support us all. Thank you.
Thank you, Allison. Next, we're bringing up Adriana Moreno. She is a mom, community member, and supports work with the Building Healthy Communities Initiative in Santa Ana.
Hola, buenas tardes. Saludos a todos los que nos están viendo o escuchando a través de las redes sociales de donde estamos transmitiendo esta conferencia de prensa. Como la compañera compartió, quiero agradecer a todos los sectores de trabajo que nos ayudan a mantenernos saludables. Gracias por todo el trabajo que hacen. Empezaré por presentarme. Mi nombre es Adriana Moreno. Soy mamá. Tengo un niño de 9 años, una niña de 5 años. Y como muchas mamás o papás, estamos preocupados por lo que está sucediendo. Estoy aquí para apoyar en lo que se puede en estos momentos de incertidumbre. Es sumamente importante para nosotros que nuestras comunidades estén bien informadas de los recursos disponibles y que existen en nuestro condado. Pero a la misma vez, queremos luchar por los recursos que aún faltan en nuestra comunidad, como programas de alivio, alivio inmediato para nuestras familias. Quiero resaltar lo siguiente. Hay que tomar en cuenta las preocupaciones de los trabajadores y de aquellos más vulnerables e impactados por este virus. Hay que reconocer que es importante mantener nuestra capacidad de recuperación intacta y mantener nuestra habilidad de tomar decisiones propias de acuerdo a nuestras necesidades. Recordemos que hay mucho que podemos hacer para apoyar a los afectados en estos momentos por causa de este virus. Tomar en cuenta que estamos aquí para cambiar el racismo y la xenofobia contra las comunidades inmigrantes. Queremos que sepan que existen muchos grupos a través de todo el estado que están tomando acción para apoyar con esta causa. Al nivel local, nuestro grupo está aquí para tomar acción y los queremos animar a que se unan a nuestros esfuerzos. Una manera de apoyar es agregarse a la carta que hemos escrito dirigida a la mesa de supervisores del condado. Esta carta explica mucho más en detalle por lo que estamos luchando. Así que los invitamos a que se agreguen a esta carta. Gracias.
Thank you so much. The next person we'd like to bring up is Dr. Michael Nguyen. She will be sharing in English, Vietnamese, and Spanish.
Good afternoon, everyone. Thank you for having us, Viet Rise and friends from community health organizations, community-based organizations. It's a beautiful day on St. Patrick's Day in the OC, and I want to remind everyone how blessed we are to live in warm climes. My name is Dr. Mai Phung Nguyen. I am an adult physician in internal medicine. I did all my training in a place called USC Keck School of Medicine. It's one of the largest public hospitals in the world, actually. And there I garnered incredible experiences that prepared me to do volunteer missions in Honduras, Ecuador, my native Vietnam, and also study in India. I'm not bragging, I'm just telling you my experiences to be a trusted community health leader to chime in on the current epidemic globally. Currently I work for 360 Healthcare. It's a very special organization that allows me to work with nurses, case managers, and see patients at the bedside in their homes, whether they live in an apartment, an assisted living, or a nursing home. I've been asked to speak today to clarify about what are the current formal recommendations for reliable, science-based, easy-to-do things that we can all comply with in order to prevent getting sick with COVID or coronavirus 19, as well as spreading it. It is so important to hear from clinicians and experts in healthcare because there is so much hysteria and panic that we are witnessing every day because this pandemic is changing every minute. I want to remind everyone that the name COVID virus stands for coronavirus. It's a flu virus. We've all seen a cold and cough and a flu. What's different is it's a very virulent or powerful and strong flu, and we really don't know how it's spreading so quickly. And so this is the reason there's been a great deal of fear. For those of you who understand epidemiology or infectious disease, the germ theory, you have to be introduced or exposed to a bug. And the second part of an infection is you have to be susceptible, meaning your immune system has to be weakened, tired, or just debilitated for a number of different reasons. It doesn't have to be just cancer. People with diabetes, people who are sleep deprived, people who are malnourished, can be more increased risk for getting infected. So when we talk about the recommendations of how to minimize our own infection and spreading, it's really coming back to common sense, easy to do things. First of all, stay calm. Practice good hygiene. I have a 10-year-old, it's not that hard. Wash your hands often. And when we say wash your hands, it's soap and 20 seconds of running water. If you're homeless or you don't have running water, whatever form of water is fine. I emphasize hand washing because it is so far superior to hand sanitizers that people are buying in mass. Hand sanitizers is just a form of alcohol, and you kind of just spread all the goop and the dirt around, and hopefully it kills some of it. Suds helps prevent the virus from staying on to your hands because the soap causes it not to be able to stay on your skin. So hand washing, 20 seconds. That's 2 ABCs, A, B, C, D, E, F, G. Got it? The next, if you're sick and have a cough, cough into your elbow. We teach this to our small children. I do not understand how adults cannot do this. Then, of course, this is now infected, so this is transmissible. But the idea is you don't spread it out into the far distance. Thirdly, they talk about this distancing of 3 feet. I'm about 5 feet tall, so my wingspan is about 6 feet. I should not be closer than 3 feet. The idea is this is a droplet. The virus lives in your spittle, so they think 3 to 6 feet is the magic number. If you're sick, they don't have these face masks anymore. A plain bandana, so a cool bandana of any shape, size, or color is a good idea because it acts as a physical barrier so your spittle doesn't spread like on this microphone. And so bottom line is if you're sick, stay home. When should you go to see a doctor, a clinic, or urgent care? When you're very sick, meaning you have a high fever that isn't going away with Tylenol, Advil, you have a cough that you cannot control, or you're short of breath, or you have the chronic illnesses we talked about, diabetes, hypertension, cancer, and a number of frailties. So let's continue to stay informed, listen to good guidance from clinicians and experts. There's a lot of information and not all of it is good for you. Hopefully today, at the end of our presentation, we're going to give you a wonderful list of reliable sources. And I just want to bring your attention to 3 organizations: WHO, Who's Who, World Health Organization. So Google that, and CDC, Center for Disease Control, that's from a national level. And then locally here, the California Department of Public Health, CADPH. And now I'm going to try to do all this in 2 other languages. So here we go. Off the cuff. Kính thưa quý vị, tôi là bác sĩ Mai Phương, tôi là bác sĩ về nội khoa. Tôi tốt nghiệp tại trường USC, University of Southern California, tại một trong những bệnh viện lớn nhất trên nước Mỹ mà chăm sóc cho mấy người mà thu nhập thấp. Vì vậy tôi có rất là nhiều kinh nghiệm để chăm sóc cho những người mà từ nhiều nước đa văn hóa khác nhau. Ngoài ra tôi đã đi học ở bên Ấn Độ, Mễ Tây Cơ, với lại làm việc thiện ở nước Việt Nam, với lại Honduras ở dưới Nam Mỹ và Ecuador. Tôi không khoe nhưng mà tôi chỉ chia sẻ để cho quý vị biết là tôi có nhiều kinh nghiệm chăm sóc cho những người mà có lẽ có thu nhập thấp hay là bị nhiều bệnh kinh niên mà không có phương tiện để tự chăm sóc. Hiện tại tôi làm cho một cơ quan gọi là 360 Healthcare. Cơ quan này là gọi là bác sĩ chăm sóc tại gia, tức là tụi này chúng tôi bác sĩ tới tại gia của những bệnh nhân mà rất là bị bệnh nặng, có nhiều bệnh kinh niên mà có thể bị khuyết tật. Vì vậy tôi có rất là nhiều kinh nghiệm chăm sóc cho những người mà cần thiết sự chăm sóc của người bác sĩ giỏi, có nhiều kinh nghiệm và có thể giúp ở nhà, không có cần nhiều máy móc của bệnh viện với lại sở y tế. Hôm nay các trẻ em trong việc RISE và những cơ quan mời Mai Phương đến đây để chia sẻ với quý vị những cái bí quyết và những cái lời khuyên của những bác sĩ và những cơ quan y tế chia sẻ với chúng ta. Trước hết chúng ta nên bình tĩnh, đừng có vội, đừng có tự nhiên sợ hãi và đi mua quá nhiều đồ. Thứ nhì, nên rửa tay. Rửa tay rất là quan trọng và có thể chống lại và ngăn ngừa rất là nhiều bệnh. Làm cách nào mình nên rửa tay? Mình nên rửa tay với xà bông, tức là soap, ít nhất 20-30 giây. Cái vấn đề mà rửa tay với xà bông rất là quan trọng, tại vì với cái xà bông đó nó không có cho phép cho cái con vi khuẩn nhiễm trùng nó dính vào cái da của mình và có thể rửa đi. Và theo Phương khuyến khích những trẻ em trong lớp 4 của con của Mai Phương là mình hát ABC 2 lần. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Quý vị đã hiểu. Sau đó quý vị nếu mà bị bệnh, có sốt, có ho thì ho ráng che cái ho cho nó đừng có lan đi. Và cuối cùng nếu mà quý vị bị có sốt, ho, khó thở mà không chữa trị bằng những cách thường xuyên, tức là uống nước và uống Tylenol, Advil, ăn phở, chicken soup, thì quý vị có thể nên đi gặp bác sĩ. Quý vị không nên đi ER với lại nhập emergency room, phòng cấp cứu, nếu mà quý vị chỉ bị bệnh sơ thôi. Và cuối cùng ai cũng bây giờ hiểu or nghe đến cái vấn đề mà social distancing, tức là mình phải cách nhau ít nhất 3 đến 6 feet. Vì lý do cái con vi khuẩn coronavirus nó là trong những cái nước miếng, những cái nước mắt, nước mũi của mình, và người ta nghĩ là mình hắt xì, mình ho thì nó có thể lan đi 3 đến 6 feet. Cho nên quý vị nên theo dõi những chi tiết bằng những cơ quan mà người ta có thể tin tưởng được, tức là World Health Organization, WHO, CDC, tức là Center for Disease Control, và cuối cùng là California Public Health Department, CADPH. You're going to give me 2 more minutes. En español, me llamo doctora Gwen, yo soy una doctora entrenado en medicina interna. Yo tengo más de 25 años de experiencia cuidando a mucha gente de todos lados del mundo. El virus nuevo que se llama coronavirus, COVID-19 del año 2019, está con nosotros, está dando mucho miedo a través de todas nuestras comunidades del mundo. Estoy aquí para clarificar para ustedes sobre las recomendaciones formales de las organizaciones de salud como World Health Organization, Salud Mundial, CDC, Centro de Infecciones
Y enfermedad.
gracias de enfermedades en California Public Health, Salud Público de California. Las 4 recomendaciones mayores son: quédate calmado, no te preocupes tanto si usted es saludable, trate de practicar higiene, buena higiene, como lava las manos por 20, 30 minutos, o segundos, lo siento. Es como cantando ABC 2 veces, A, B, C, D, F, G, con jabón y agua. El jabón combate el virus, no se permite penetrar nuestra piel y por eso no se contagia. Es muy importante cuando se encuentra a alguien enfermo, después laven las manos. Si tiene tos o tiene fiebre, por favor quédate aislado, no cerca de otra gente que está saludable. Si tiene tos, por favor tose dentro del codo para que previene spread, contagia a otra gente. El virus de coronavirus es de grupo de flu o gripa y se vaya por las gotas de saliva y las lágrimas y desecho de nariz. Por eso, por favor, traten de no de spread it. Yeah. Por eso, por favor, escucha las noticias, pero cuídate que escucha las noticias con confianza, como de WHO, World Health Organization, Centro de Enfermedades Infecciosas, CDC y también Salud Pública de California, California Public Health Department. Gracias y cuídense bien a su salud.
That's awesome. Thank you, Dr. Maiphone. All right, so for our next speaker, we would like to bring up Terry Nguyen. Terry is a high school student here locally and is also a member of our youth program. Thank you, Terry.
So, hi, my name is Terry Nguyen, and today I'll be expressing my fears surrounding coronavirus as a high schooler, and especially as an Asian American high schooler. I would like to believe that America is the land of the free. I would like to believe that California is the most welcoming and diverse state in the country. I would like to believe that every day Asian Americans aren't being economically oppressed and harassed. But as of recent, it's hard to maintain this facade that everything is okay. As everyone knows, the coronavirus has become a pandemic, leading to the infection of thousands in the US and the death toll in California being in the teens. The damage caused by this global crisis has made me feel tremendously sad. So many lives in the community has been impacted in so many different ways. But despite the direct effects of the disease, what I fear most is the mass hysteria and precautions made by the general public. As a result of our fears, our economy has crippled, and many people have taken this situation as justification to oppress what they believe is the cause of the disease: Asians. You can see it in our streets, where 68-year-old Asian men are beaten and abused. You can see it in our schools, where high school Asian kids in Bolsa Grande High School have been verbally attacked. You can see it affecting our businesses, where Asian businesses have been socially boycotted. Although I hate the fact that I have to say this, the actions of these people have made it clear that someone needs to say it. Our race is not a virus. So how do we solve these problems? Any global issue needs to have global collaboration in order to be resolved. And I still believe that our community can pull together and unify in order to lighten the issue of racial injustice. Even in this time of social separation, we can still be morally together. It is only in this way, through the unity of all races, especially minorities, can we heal the cycle of hatred, fear, and pain. Thank you.
Thank you so much, Terry, for sharing. Next, we'd like to bring up Garden Grove Board of Education President Walter Munitin, who has been really great and supportive to our community.
Good afternoon. My name is Walter Munitin, President of the Garden Grove Unified School District Board of Education. Today I will be speaking about an incident that occurred at one of our Garden Grove schools earlier this month, and also touching on how our local elected officials can assist us in these uncertain times. On March 8th, administrators from Bolsa Grande High School and the Garden Grove School District were made aware of videos of two students filming themselves on campus engaging in profane, disruptive, disrespectful behaviors, which included mocking and harassing Vietnamese students in an assembly and on the campus. The behaviors shown in those videos are unacceptable and will not be tolerated by Garden Grove School District. Disruptive and biased hate speech and similar actions have no place in our schools. Rest assured that any students engaging in such behaviors, including hate speech, biased activities, will be facing disciplinary action in accordance with California Education Code. Garden Grove Unified is working with our community partners to take a firm and unwavering stand against any and all acts of hate speech, and has developed a district-wide plan to be able to promote a safe and welcoming environment at all of our schools. I would like to remind staff, students, parents, and members of the community that any racist or xenophobic language, either in person or via social media, must be immediately reported to Garden Grove Unified School District officials. Garden Grove Unified is a highly diverse district dedicated to equity and inclusivity. We value all of our students and embrace a multicultural, multilingual, and multiracial school district that we are. We must not use the coronavirus as an excuse to be a bigot or a racist. I am certain that our community can take a stand with me this evening and denounce all forms of racism. Now, in reference to what our local elected officials can do to assist our community, I am calling on the Orange County Board of Supervisors to provide rapid and transparent government plans on how they plan to prevent outbreaks, and at the same time not incite panic or fear amongst our community, especially our most vulnerable. Yesterday, Governor Newsom issued executive orders that authorizes local governments to halt evictions for renters and homeowners and protect against the community against utility shutoffs. This being said, I would like to call on all of our local city officials, our council members, to immediately enact a moratorium on rent increases, late fees, utility shutoffs, and evictions for renters and small businesses. As a social worker myself, I know firsthand how moments of crisis can impact our mental health, especially when combined with financial burden and housing insecurities. We need our elected officials now more than ever to stand up for the residents that they serve. Thank you.
Thank you so much, Walter. So for everyone who came here today, we wanted to show you all the things that we're doing to work together as a community. The last person we'd like to come up to speak is Indigo Wu. Indigo is an educator here locally, and our community member who's been putting together time and they'll be sharing a little more about the resources that they have.
All right, in response to COVID-19, a group of our community members have come together to put together a resource guide for OC residents. This guide is available at bit.ly/cv19OC resources. It includes information about school closures and food distribution, physical health, mental health, labor and worker rights, immigration, local assistance programs, and links to other resource guides across the United States and more. This document will continue to be updated as developments are made. Again, the resource guide is available at bit.ly/cv19OC resources, and we'll be putting that board back up at the end for everyone to access later.
Buenas tardes a todos. Brevemente quiero compartir en español lo que Indigo acaba de mencionar como respuesta a lo que ha estado sucediendo. Este grupo de miembros comunitarios y profesionales ha tomado la responsabilidad de crear esta guía de recursos para los residentes de este condado de Orange. El guía incluye información de ciertos distritos escolares y las escuelas que han cerrado pero están proviendo almuerzos o repartiendo alimentos. También hay información sobre la salud física, salud mental, derechos al trabajador, inmigración y otros tipos de programas. Está disponible en la línea la información que ella puso, que también se va a proveer al final de la conferencia. Pero también quiero tomar un breve momento para reconocer que estamos recaudando más información relacionada con apoyo inmediato para las necesidades básicas de nuestra comunidad. La organización conocida como Construyendo Comunidades Saludables, SABHC por sus siglas en inglés, está preparando una encuesta para recaudar información más detallada acerca de las principales necesidades de nuestra comunidad, específicamente aquí también en Santana. Para más información sobre la encuesta, por favor de visitar la página de Facebook @SABHC1. Muchas gracias.
Và dạ cảm ơn. Xin chào quý vị. Alison sẽ bây giờ giải thích tiếng Việt. Một nhóm các thành viên trong cộng đồng của chúng tôi đã tập hợp lại hướng dẫn tài nguyện cho cư dân quận Cam. Hướng dẫn này có sẵn tại trên cái website này. Lát nữa mình sẽ bỏ lên nữa lúc mà nói xong. Và cái hướng dẫn này sẽ báo gồm thông tin về việc đóng cửa trường học và phân phối thực phẩm, sức khỏe tâm thần, quyền lao động và người lao động, nhập cư, các chương trình hỗ trợ địa phương và liên kết với các hướng dẫn tài nguyên khác. Tài liệu này đang tiếp tục được will add on, right? Khi cách phát triển được thực hiện. Một lần nữa, cái hướng dẫn này có sẵn ở trên cái website của Vietrise và lát nữa xong rồi tụi em sẽ bỏ lên lại.
Thank you, Indigo, Allison, and Adriana for letting us know where we can find the resources. So that will be the last of our speakers, and we're moving toward the portion right now of our short Q&A. Unfortunately, due to time, we're only going to be taking 3 of the frequently asked questions that we've been hearing from community members, just to ensure that everyone gets, we can provide as many resources as we can right now, given who we are as community-based organizations and who we can connect you to. So we've been compiling questions that we've been getting through our live streams and our different accounts that people have been messaging to us directly. So one of the questions that we hear often are from immigrants who have a question around public charge. There's been a question around whether immigrants should worry or not about their future applications being impacted if they apply for benefits, government benefits during this time. USCIS had just recently posted on their website that if any immigrant right now who plans to apply for any residency or anything in the future, it would not be impacted because of you applying during this time. The second question that we got a lot, that we tracked down just now is, what is the difference between social and physical distancing versus isolation and versus quarantine? So from the CDC, the World Health Organization, they're recommending that we all take precautions to continue to practice social distancing. Or other folks are calling it physical distancing just because we want to continue to encourage social interaction with one another, but maintaining our physical distance to keep each other safe. So physical distancing, if you can work from home, we encourage you to work from home. Dr. Maifung earlier shared maintaining at least 3 to 6 feet away from one another during this time for the next several weeks. Isolation is when you are already sick and that person is being asked to stay away from other members who are already healthy. And quarantine is for the entire community to be kept away from one another, whether you're sick or whether you are healthy. And so those are 3 different instances, so we really want to encourage you to know the difference between those 3. After this press conference is over, we're going to go straight back to working and practicing social distancing or physical distancing. And then the last question that we got a lot are for what protections do workers have at this moment? On our website, we're going to be sharing the link after this. We created several infographics in English, Vietnamese, and Spanish for residents and workers who want to know what protections they do have if they get sick, if they have to care for a loved one, or if they're going to be losing wages during this time. So all information is taken directly from from the California government. So if you look at that website, we'll share it after this link. The California Healthy Nail Salon Collaborative will also be releasing information for nail salon technicians who need that support directly. We also encourage you to go on the county website and again to our resource guide that will share all the information. So I think, do we have any other questions, like frequently asked questions to include? Okay. All right, if not, we're going to be heading into our closing now. So once again, thank you so much to everyone for joining us here today, all the speakers, and I just want to say their name again for taking time to come. Allison Vo, Adriana Moreno, Dr. Mai-Fung Nguyen, Taryn Nguyen, Garden Grove Board of Education President Walter Middleton, Indigo Vu, and everyone for joining us through the live stream. We wanted to be here today because we wanted to remind the community of our resiliency, of our agency, of how important it is for us to stand together, especially in a time of crisis. We come from generations of people who have worked together before, and we're stronger when we continue to support one another against any kind of anything that could happen to us right now. And so we want to end by uplifting the cities right now and the city councilors who are taking action to protect us. Tonight, Santa Ana City Council is introducing an emergency relief package, and we really encourage residents to send in public comment to advocate for the city council to put a moratorium on evictions, rent increases, as well as mortgage payments, utility shutoffs, and more. More information will be posted after the press conference is over. We want to highlight Garden Grove as well for taking the extra measure to ending citations and utility shutoffs. The cities of Irvine, Anaheim, and Westminster are also looking toward taking action. And so we really encourage and hope to see more from our local city councils across the county. And of course, we hope to hear more transparent, clear direction from our Orange County Board of Supervisors. There are a lot of actions that are being taken right now, a lot of amazing groups doing work to make sure that our community members who are most impacted, either economically or health-wise, are going to be supported. So after this, we're going to put up just a link for you all to be able to go to. Once again, thank you to everyone. Thank you for joining us, and we hope you have a great rest of your day.